Hello there! Today we are going to be learning how to administer basic first aid and treat injuries such as cuts, burns, hypothermia, nosebleeds, and heat exhaustion. Let's get started. First up is burns. There are several different stages of burns. First-degree burns only affect the top layer of skin. The skin will be red, possibly swollen, and the skin might be peeling. These usually heal on their own in 1 to 2 weeks, and if a burn takes longer than 4 weeks to heal, check up with your doctor. To care for first-degree burns, place a cool pack on the affected area, and then you can apply antibiotic ointment to the burn to decrease recovery time and promote healing. Because first-degree burns are quite minor, you do not have to cover them with a bandage or anything. You can leave them open until they heal. Next up is second-degree burns. Second-degree burns burn through deeper layers of skin. The skin is red, blistered, and possibly wet. Mild ones usually heal on their own in 2 to 4 weeks, but more severe ones, such as the one on the left below, may need professional care. To care for minor second-degree burns, apply antibiotic ointment to your burn. Then cover the wound with gauze or a large bandage. Keep an eye on it, and if it doesn't heal within 6 weeks, check up with your doctor. Third-degree burns are more severe. They burn through all layers of skin, and the skin may appear charred or dark in color. It also may seem leathery or swollen looking. However, these burns might not be that painful if the burn actually damaged the pain receptors. Do not attempt to care for this burn by yourself. This should only be attempted by a professional. Call 911 and wait for help. Ensure that no clothing sticks to the burn and keep the injured person calm. And the final degree of burn we will be covering today is fourth-degree burns. These are extremely severe. They can burn through fat, muscle, and even bone. Deep layers of tissue, possibly bone, might be exposed, and the skin will look black and burnt. As with third-degree burns, you should not attempt to treat this burn by yourself. Call 911 and wait for professional help. Again, ensure no clothing sticks to this burn and keep the injured person calm. On to cuts. We will be looking at the 3 most common kinds of cuts today. First up, puncture wounds. These might not bleed that much, and they are small but go deep into the skin. They are caused by long, pointy objects such as nails protruding into the skin. To treat puncture wounds, first apply pressure with a clean cloth to the area to stop bleeding if there is any. Then use soap and warm water to clean out the wound. Apply antibiotic ointment if you wish, and then cover the wound with a bandage. Even if your puncture wound is small, you should still check up with your doctor, as these kinds of wounds can get easily infected. On to abrasions. These cuts also don't usually bleed that much. They only cut the surface and are caused by the scraping of the skin on a rough surface, such as asphalt or concrete. To treat abrasions, apply pressure with a clean cloth to stop any bleeding. Wash off the wound with soap and water. You can do this with a washcloth if you'd like, and simply dab the area. Then, rinse off the wound with water and pat it dry. Apply ointment to the wound. Then, cover the wound with a gauze pad held in place by first aid tape or a large band-aid if you have it. Now our last type of cut, lacerations. These ones usually bleed a lot more than the other two, and they can be shallow or deep. They are caused by sharp objects cutting into the skin, such as a knife or a sharp tool. To care for lacerations, apply pressure to the wound with a clean cloth to stop all bleeding. After the bleeding is stopped, wash out the wound with soap and warm water. Then apply antibiotic ointment to the wound to prevent infection and promote healing. Keep the wound covered with a bandage for the first few days, then you can uncover it. Next up on the list is heat exhaustion. Heat exhaustion occurs when the body overheats. Some symptoms of it are excessive sweating, nausea or vomiting, dizziness, fainting, weakness, and muscle cramps. To care for heat exhaustion, move the affected person to a cool area. Give them sips of water and place cool, wet cloths on their body. If heat exhaustion goes untreated, it can develop into heat stroke, which is severe. If the person becomes confused, develops a fever of over 103 degrees, or falls unconscious, call 911. These are signs of heat stroke. Up next is frostbite. Frostbite occurs when the body is exposed to very cold temperatures. Symptoms include cold, hard, numb skin, and skin that may be white, gray, red, or yellow in color. It might also feel firm or waxy. To care for frostbite, seek a warm, dry place and place frostbitten areas in warm, not hot, water. Wrap frostbitten parts of the body in blankets or use body heat if neither are available. Do not use a fireplace, electric heater, or similar. Frostbitten areas are numb and they could burn without you noticing. Hypothermia. Hypothermia occurs when the body's core temperature falls below 95 degrees Fahrenheit. Symptoms include shivering, confusion, exhaustion, memory loss, frostbite, and drowsiness. To care for hypothermia, seek shelter ASAP. Remove wet clothes and put on warm, dry ones. Wrap the affected person in blankets. Do not put the affected person in a hot bath. This could shock the body. Instead, use warm water for frostbitten areas and use blankets or body heat if neither are available. Finally, we have nosebleeds. These are usually very minor, and they can occur for a variety of reasons. When a nosebleed hits, make sure you lean your head forward so the blood can come out by itself. Do not tilt your head back. This can cause the blood to run down your throat and you can possibly choke. If a nosebleed lasts 10 minutes or longer, check up with your doctor, and call 911 if the blood is not stopping. Here is a list of some basic first aid kit supplies you should have in your first aid kit, which you can stash in your car, at your house, or anywhere emergency might strike. In your kit, you should have gauze, first aid tape, assorted bandages, antibiotic ointment, scissors, water, a cool pack, blankets, clean cloths, tissues, and mild soap. Hopefully you never find yourself in a situation where you have to use the information you learned in this video, but now if you do, at least you'll know how to treat certain injuries properly. I hope you enjoyed this video, and if you did, please like and subscribe, and thank you so much for watching.